Hello, I'm Anna Kroll, Women's Health Physiotherapist. This is a video to explain how to massage your pelvic floor scars. So that might be scarring from episiotomies or birth-related tearing. If you have just had a baby, then please wait till things have fully healed before commencing this massage. So that might be 3 to 4 months postnatal. Having said that, if you are 20, 30, 40 years postnatal, this should still be beneficial. Before we begin, just a couple of words of caution. If you've got a coil, then it's good to check your coil strings every so often. If you notice a significant increase or decrease in their length, then pop down to see the nurse at your GP practice. This massage is not suitable throughout the majority of a pregnancy. It is okay to do this in the last few weeks of pregnancy, if your midwife says it's safe to do so. If you've ever had any major pelvic surgery, so that's a hysterectomy or prolapse repair surgery or any other major pelvic surgery, then please don't try this. Instead, go and see a physiotherapist for a proper individualised assessment and to work out a treatment plan that's right for you. This video does not replace an assessment with a physio. It's just advice and tips on technique. The best position for you to do your massage in is a kind of half sitting, half lying, propped up with cushions sort of a position. So propped up in bed at the end of the day is ideal. I think it's best to use the right hand when working on the left pelvic floor and the left hand when working on the right pelvic floor. This is because having a position like this is going to hurt your wrist after a short time, whereas a position like this is nice and easy. Okay, let's begin. So, say we were starting on the right hand side, start with the left hand. Take the thumb and pop it into the vagina, planting it down on the back wall, just right of centre. You might want to be somewhere between a half thumb and a full thumb depth. So the thumb comes into the vagina, plants down on the back wall, just right of centre. Take the fingertips from the first two fingers and pop them onto the outside, onto the perineum. This means that you'll have between your finger and thumb those first layers of tissue, okay? When you've taken hold of that tissue between the finger and thumb, you can then do little squeezes and squishes, or you can do a kind of rolling between the thumb and the fingers, or a gentle drawing of the tissue away from you and back towards you. Okay, looking at the other side, you're going to take the right thumb into the vagina, coming down, planting down onto the back wall, just left of centre, fingertips onto the outside. So taking hold of that bit of tissue right at the entrance to the vagina. And again, it's little squeezes, little presses, working the tissue between the finger and thumb and gently just drawing it away and back towards you. I think doing that massage for about 10 minutes in total, most days, is really useful for improving the flexibility of the scar and so reducing its effect on any pelvic health problems that you might be having. Try to do it for 10 minutes most days. You don't need to do it when you're on your period or if you've had a bad day or you're stressed, but as a general thing, if you can try and do it little and often, that'll be really helpful. The sorts of things that you might feel include a bit of a scratching sensation or a pulling or even a very slight burning sensation, aching or tenderness. But these sensations should all be at a really low level, and these sensations should stop as soon as you stop doing the massage. If you feel like those sensations are happening more strongly or more severely, or they remain after you stop the massage, then you're working too hard into the tissue. Your pressure is too hard, so next time go more gentle. You should not need to use lube when you're doing the massage, but if you do, then remember that you want to have a good grip on the tissue. So only use a little bit of lube and use something nice and natural, organic based. I hope this video has been useful. Thank you very much for listening.